Hello and welcome to another Big Mish movement workshop. Today I wanted to bring a quick little discussion talking about core biomechanics and how it all works. First of all, why? Because there's a lot of little misconceptions about core, what the core does, how do we work the core, what do we do when we're moving with the core, with our core, how do we get better with our core, etc., etc. Some people think that it's about abs and doing lots of intense work, intense burning, leg lifts and all that stuff. Maybe not so much. Other people think it's more about spinal stability. Now we're getting a little bit closer, but I think there's a little bit more specific stuff that we need to understand, because spinal stability still sometimes implies a little bit of rigidness, and we want to move away from that, because at the end of the day, we are moving human beings, and that's the problem, is that we're having trouble moving efficiently, and our core is not moving with or helping us move the way we're supposed to. So what would we say core is? What is core? Well, core is management of our rib cage movements relative to our hip, because they have to often match each other, otherwise we're going to have some problems, while also managing compression and expansion of air in the rib cage, because like I said, we are moving, breathing beings. We have to be able to breathe as we move. So just to talk a little bit about what is going on there, where we have the hips. These are my models today. Maybe one day I'll get an actual rib cage where I can demonstrate a little bit better. But for today, purple will be pelvis, blue will be the rib cage stacked. So when we have our rib cage, our pelvis, which is governed by 2 feet. So that means it will always be lateralizing from one side to the other as we're walking and moving throughout our day. This rib cage that sits on top is going to have to move with it. Now, what governs these two is going to be our head and the thoughts and our goals and what our needs are. Problem is, we often think of a human body as being very stagnant and static, and the problem is that what we're often doing too much of in our day is sitting. We are moving beings. Whether you like it or not, you're going to have to at some point move from point A to point B. And our ancestors moved a lot more, but in our digital tech era that we live in, people are being confined to their seats. But even then, you will run into problems if you don't manage your movement strategies. And like I said, at some point rather in your life, you're going to have to move. So our core is what actually helps us get through this relationship with efficiency. And then obviously we run into different tasks, stresses. Maybe our body's going for a long time. We're not getting enough rest. We're getting fatigued. All of that stuff. That's when accidents happen, and that's when you make a movement and so forth, your back might act up or ache or spasm, vertebrae disc damage down the line. You name it, all that stuff. Because why? More often than not, it's because we did not have a good core, a solid foundation to support it. Oftentimes, even knee problems, as much as we can assist with good hips, it's the hip to rib cage relationship and core stability that sometimes causes these erratic movements in our hips to cause knee damage down the line. So this is why our core stability is so important for our whole body pattern, even for lower body issues, because of this managing the relationship of keeping our hips nicely in line with our pelvis. Pelvis nicely in line with our rib cage. Okay, even I'm confusing myself with these, but like I said, one day I'll get an actual rib cage model. So what does this mean? There's 2 parts here. There's stability that needs to happen, but there's also controlled movement that has to happen. Underlying factor is control. So stability often referred to as just being stationary. And that's where commonly when people had back problems or anything where a stronger core was prescribed, we were put into positions which worked on a lot of stability, but we neglected the movement. And that's the problem, is that stability can sometimes just cause more rigidness that actually will then hinder more movement. So we must be able to breathe and manage airflow with this controlled movement that we're trying to adapt. And that's what our core training should really reflect, is these healthy movement patterns that I'm about to break down. And then one of the reasons why we actually want to really exploit all movements necessary is because at the end of the day, our body will pick the path of least resistance. This is just a habit our brain does. We're not often being mindful enough of our movements. We're just thinking of, we're being mindful of what needs to be gotten done. And as we execute and go throughout our day, we're not really thinking about, are we bending our hips the right way? Are we using the core as we bend over to pick something up? Is our back straight? Is it bent? Etc., etc. We're not being mindful of that. We just want to get it done and then get to rest or whatever it is, eating. Usually rest, digest something until it's time to go to work again. So this lack of mindfulness allows our brain to just be, well, we're going to be very sparing because this is a tactic of survival down the line of our ancestors. We're always going to be preservation based. We're always going to preserve. So therefore the brain is naturally going to pick the path of least resistance. It's not making a bad choice. It's just trying to help you out. However, down the line, if you're picking the path of least resistance, you're gonna probably wear that area thin a lot quicker. So maybe not the best choice. This is why we wanna be a little bit more mindful of how we can move in all directions. And that's where I'm gonna break down to the 3 planes of motion. At the end of the day, we live in a 3-dimensional world, and that's 3 planes of motion. We have forward and up, side to side, and side to side, and then rotational. This would forward and back would be called your sagittal plane, the side to side would be called your frontal plane, and the rotational is called transverse plane. So I'm going to break down how the core works and what or lack of movement that is happening in each plane, and what are some of the exercises we can do. Starting with the most basic and the one we all live and are stuck in, the sagittal plane, the front to back forward plane. And this is very signifying of the life we live, which is a forward progressing life, and that is an actual matter of fact. So that is one clear reason of why we have a very common posture of a forward tilting pelvis and a very arched back. Your very common anterior pelvic tilt and a lordotic curvature. This is a natural spinal pattern and is actually what makes the most sense because we are, at the end of the day, forward moving beings. The problem is, however, we've gotten so lost over the many years and not developed the correct muscle integrity and musculature. So we've fallen into excessive anterior pelvic tilt and excessive lordotic curvature. What that does is put a lot of stress and strain on the lower back. It primes the lower back to fire for a lot of movement. The position of the pelvis means your hamstrings will probably be in a lot of stress or strain because they're being pulled up by the forward tilting pelvis. And therefore, they're not necessarily tight, but they actually need a little bit more strengthening, grounding to pull that pelvis down. And chances are they're probably not going to be feeling too great when anybody's pelvis is pointing forward. It also puts them in a bad position of leverage to fire, which is not very good. Speaking of position of leverage to fire, our core. When you have an overextended back, it puts our core in a very poor position and poor leverage position, to fire. And therefore, as much as we might do some core work, at the end of the day, if we're biasing another dominant muscle posteriorly, that's not necessarily going to help us when we're completing movements that are stressful or we're not prepared for, because the dominant one is what will fire, but more often than not. This is why it is important when we're working on core, especially in the sagittal front to back plane of motion, we want to really work on stacking the rib cage over the hips. Whereas we're more like this, we want to do a little bit like this, or at least bring some neutrality back into this plane of motion of stacking the ribs over the hips, just because we're so commonly doing the opposite. What is that doing to our breathing system? Because at the end of the day, we're moving, breathing beings. Well, what that's actually doing is putting our rib cage into a narrower position, so we're not getting as much air in. The other problem with this is that it puts our diaphragm into a state of tension and actually helps further lock our back into that position, because the diaphragm tends to be such a powerful muscle. In that bias leverage position, we tend to use this posterior chain and diaphragmatic tension often to help facilitate for powerful movements. Fake core, or fake using the core. I know this is how oftentimes people complete max reps for powerlifting and whatnot. However, you're not pressurizing your midsection, and you will be recruiting tension throughout your entire body, because that's what diaphragmatic tension does. This would be when you do a typical breath hold, you complete the rep, and you breathe out at the end of the rep. You're holding your breath while you do the movement. What that's doing is just gonna tense up your whole body, and at the end of the day, limit your movement capabilities. What we wanna be able to do is be able to breathe throughout, exhale throughout our movements. And what that will do in turn is help stack our ribs over our hips. And what that will do is centralize this pressure, allowing us to hit a lot more stronger throughout our midsection, and therefore our extremities, arms, legs can be a little bit better leveraged to push or pull. So that's the goal of the sagittal plane of core, and why we want to be mindful of not being overly extended our back. Two reasons: because it could definitely wear our back out and prime it dominancy for movements, but more so, I would say the more powerful factor would be the diaphragmatic tension of what that does and how that biases that together hand in hand to make this a lot more of a sort of a stressful recruiting position, whereas this one would be a more controlled, centralized pressure means of being able to lift or manage stress, whatever it may be that we're facing. So what are some exercises that we can do? Well, a lot of the dead bug variations. Dead bugs are anytime you're lying on your back and you got your legs, you're lifting them and you're lifting them up and down, and maybe you can be doing that same thing with your arms in opposition. There's lots of different variations of dead bugs, but this is great for teaching you to keep those rib cage stacked down. Alternatively, you could turn into a hands and knees position and do lots of bear crawl variations. These are very good for, again, keeping a neutral spine, even though your pelvis will be bent at 90 degrees for this one. Alternatively, we also have some med ball tosses that we can do in this front to back plane that can help really train this position awareness. And also, most importantly, while you're doing these movements, be able to breathe and be comfortable in this position. So that's the sagittal plane. Let's talk about the next plane of motion, the side to side frontal plane. So this is often where 99% of human beings will be biased to one side. A big factor will be the fact that our diaphragm, the central tendon of the diaphragm, is a whole vertebrae lower on the right side versus the left. In addition, the right side of the diaphragm is much bigger, better supported because of the liver, and it just does a much better job of pushing air in. But what that will often result in is a better support, a better functioning right oblique, and a little bit of a tilt of the right rib cage to the right side. So that obviously puts, again, when we think of the path of least resistance, this is a bias that many humans face, and this is often possibly one reason why a majority of the world is right-handed. We don't often work side-to-side motions, but when we get up and move on uneven ground, go upstairs, face something uncertain, maybe a misstep or something, or we're working out, we're playing a sport, doing an activity, hiking, this is where that bias is going to do a lot of wreckage, especially as you get fatigued. And you want to be mindful of having that neutrality, because if your rib cage is always tilted, that's definitely going to work down on your spine. But more importantly, what's happening to the breathing system? Well, a tilted rib cage is going to bias air into one side, whereas the other side is not going to fill up as much. And that shallow breathing is definitely not going to do our muscle tension any good, and is only going to stiffen us up and cause it and limit movement capabilities, and be very uncomfortable as we go down the line. So what are some strategies we can work around this? Well, I love to do side plank stuff because that gets the obliques functioning, gets the obliques fired up, gets us very much aware of the obliques. Alternatively, a very good functional exercise would be farmer's carry. That's when you pretty much just walk down and up, and you're carrying a weight in one hand. You can carry it down, you could rack it, or you can go bottoms up. These are very good, this is a very good movement pattern for just working single leg stance stability and getting that oblique engaged. Alternatively, we can do some med ball stuff, but now in a change of direction or a different plane other than front to back. That can target some obliques as well. And of course, if you're breathing properly throughout this throughout these movements, like I said, you're going to be working the core and actively moving it and stabilizing, because you're pressurizing, getting that full control that you need. And while, like I said, non-biasing it into your weaker side, but reciprocating and alternating, which is the most important thing. Last but not least, the rotational plane, transverse plane. Okay, this is where most humans, again, maybe biased or don't have any at all. A lot of us are very bad with rotational patterns. Like I said, because of this diaphragmatic bias to the right, which every single normal human being has, and usually we get that frontal plane tilt to the right. Sometimes that'll be coupled with some rotational to the right as well. However, usually if you're already torqued to the right, that doesn't necessarily mean you're good at rotating to the right, because you're already there. And like I said, a lot of human beings in general aren't the best at rotation because we are already so driven forward all the time, A, and B, if not forward, we're often confined sitting and therefore not really moving at all, which is why the rotational plane of motion definitely tends to be the weakest one, if we even have a strong bias there. So what is that doing to our airflow? Where again, it is, if our rib cage is torqued and biased to one side, you're going to find that one side is compressed while the other side is expanded. And the compressed side over time is not going to get as much air in, and the side that's open up over time is just going to get better and better getting air in. And that's just the patterns that we just want to get ourselves out of. But we want to be able to get ourselves out of while we are moving, while we are managing these intense movements, stressful patterns, and being able to manage air correctly where we're avoiding this natural bias. And that's one of the reasons I really, really, really value rotational movements in our core. I think they're one of the most important, just because of this weakness of awareness, and B, the bias of the breathing system that is in hand. So what are some movements that we can incorporate to handle transverse plane? Chops. I love chops. All kinds of rotational chops, downward angle, horizontal, upward angle. They're the best. You can do it from a half kneeling position, staggered position, or in an almost single leg stance position. Alternatively, this is where we got med ball stuff again. Lots of transverse med ball throws. Or, you know, this is something bordering on what I already talked about in the frontal plane, but it's all good stuff because that is what the obliques are meant to do. They are meant to rotate us. The lack of rotation, awareness, the lack of oblique activation we have is why our lower back is so stiff all the time. This is what actually will help move and mobilize it. So this is why I love doing med ball tosses, especially if we're doing it horizontally. And then last but not least, all kinds of swings. We got some kettlebell variational swings, but there's also club swings, mace swings that are nowadays getting very popular if your gym or trainer has access to them. Very good for working rotational patterns, throwing patterns, and just incorporating this whole body holistic system where, once again, as you take a step, the hip will have to lateralize over that leg, and we want the core to be able to rotate, or the rib cage, to be able to rotate, and the core is doing all of that movement, controlling the stability, controlling the movement, and making sure we'll be able to stabilize and stop over that one leg, gravitate and handle like this. And as we move to the next leg, we want to be able to shift and do everything again. The hips have to go all the way over that heel, and then eventually want the rib cage to go all the way up and position itself over that heel. Stacking ourselves completely so that we're playing with gravity at its best and not working against gravity, leaving injury or overuse pain to come about. So with that being said, the most important thing out of all of this when it comes to core is honoring these 3D motions, because at the end of the day, that is what's going to lead to your best, most natural posture. So when you're looking at core exercises and just took a quick assessment, well, where's the movement coming from? Is it only going back, forward and back, or are we only doing stationary movement? Okay, well, that's your sagittal plane. Now, how about some side to side? That's where I named off some exercises. And most importantly, if you see some rotational stuff, give it a shot. Maybe you'll like it, just so long as we're breathing throughout the motions. That's going to be a very good thing to do in terms of exploring movement patterns and exploring gravitational shifts, which is what we want to be doing. Lots of variation, lots of variation. I don't say there's one best core exercise. At the end of the day, the core is about handling movement. And movement is endless. To be honest, there's no bad movement, just movement that we're unprepared for. And that is what our core is all about. However, I would like to say that it's probably best that we break it down to your 3 movement planes, which is front to back up, side to side, and rotational. And if you learn to manage these movements and breathe comfortably throughout, you're gonna be in a good place. Best of all, this is what's gonna do your spinal mechanics a huge favor, only because, again, path of least resistance, our biases, oftentimes our spines are locked in these biased positions. And we pick these biased positions how we do our exercise, how we move. So what we want to do is be able to get good at our non-biases, be good at our weaker sides, reciprocate, alternate, handle forward, back, side to side, and rotational, and be able to breathe comfortably, good airflow. Because at the end of the day, we must be able to breathe and manage airflow, because that is what gives us the comfort and support to accept these positions. If not, we tend to stress and fall back to our biases. So core breathing is all in one. I've done a previous workshop on that. Please go check that out if you want to know more about how core and breathing are interconnected. But for this one, hopefully you've got a better understanding of how now you should break your core exercise down to these 3 sort of movement planes, so that you're always working on it, aware of your breathing, aware of your shifting and gravitational positions as you move from side to side like a moving human breathing body. If you're somebody that's interested in a breathwork consultation, please shoot me a message. I would love to work with you. Please don't forget to subscribe to my YouTube channel. I would love for you to support me in there. And if you would like to have any questions about what I talked about, please shoot me a comment. I would love to hear from you. That's all I have for today. Take care for that, and bye for now. See ya.